Well, I think that's extremely important. And of course, I've spent my whole medical life as a teacher at one level or another, well, not as a medical student, but as a resident, you're teaching the students and you're teaching each other. And as a faculty member, you're teaching students and residents. And very important, you're teaching patients. I feel that one of the most valuable things I do is to educate the patients about their diseases and the treatment of their diseases and the various approaches and the pros and cons of various pathways. So I actually think I spend more time teaching the patients than actually caring for them. And I think they greatly appreciate that because a lot of physicians don't do that. When I was a first or second year medical student, there was a senior professor who was very old, probably younger than I am now, who would invite a small portion of the class, about 8 or 10 people, to join a group that would meet at his mid-Manhattan apartment for tea once a month in the late afternoon. And he would discuss not the academic component of medical school, but the philosophy of being a physician and being a good citizen of the world. And he said many interesting things, but one of the most interesting, and the one I've never forgotten, is that every time you leave a patient's room, the patient should feel better. If you haven't made the patient feel a little better, you have failed your task. And occasionally that's very difficult if the condition of the patient is serious and maybe terminal. But nevertheless, I've found, as he said, you can always have something positive to say. And I've never forgotten that, and I've used that philosophy that he taught in all my dealings with patients. Now, of course, a much higher proportion of our medical practice is in the office rather than in the hospital. But the same principle would apply.